So we're now going to move on to the second part of our series, which is a nice complement to what Professor Goodall just talked about. So we have Dr. Appolinaire Manirafasha and Dr. Nahayo Ernest. They're both working in Rwanda, and both of them are a part of the Rwanda Emergency Care Association. And they've been at the front lines of the COVID-19 response in Rwanda, and are here to share a bit of their experience, their response and preparedness, and the approach that Rwanda has been taking to managing the COVID-19 epidemic in their country. So, doctors, can you hear me, and are you able to share your screen and your presentation?
Hello, I'm Dr. Appo. I'm an emergency physician. I'm working in Rwanda, and I present to you the journey of COVID-19 patients in Rwanda. I will be talking about preparedness within our hospitals. Regarding the management, Ernest will present it to you. As I said, Dr. Appo, I'm an emergency physician. I'm working at my hospital as someone working to manage COVID-19. Most of the time, it's through preparedness and screening, because the treatment is done on the other side. As we said, we will go through how we do our screening, how we do our isolation, and at the end, we'll be talking about how we do our management. Mostly it will be presented by Dr. Ernest as someone who is working at treatment center. Let's start with our patient flow. Our patient flow are from home, from international borders, or from airports. And then when patients is having signs of COVID, when he's at home, she may call the number 114 for like guidance, because like it's a call center where anyone who has question or concern regarding COVID may use to be oriented to get the tests. Okay, people from international borders immediately isolated at the borders, the same as patients from outside who came through airport. Okay, as I said, from home, if someone has symptoms, she may call the number. For international borders, immediately they are going to isolation center, and then the COVID test is done, and they wait within that isolation center for the results. This applied also to the airport, where immediately from airport they are sent to isolation, and then from the isolation the COVID test is taken, and they wait for the results at that isolation center. Those isolation centers, they are like rooms, self-contained, where no patient is meeting another one, because all of them, they are suspected as some people who are coming from abroad. Okay, those like voluntary testing, there are people who can come at the hospital for like self-testing. In our hospital, we have like divided our hospital into two, with like normal patient and the others with suspect. Where if you are a suspect or you come for COVID, you are not passing in the same way as someone who's coming for other problems. At that time, there is a screening gate where everyone is coming. There is a paper. There is a customer care who is in charge of filling whether has been in contact with someone with COVID, whether it has been travel abroad. And then after filling that paper, they are sending according to the complaint. If he has signs, immediately is sent to isolation center. If asymptomatic, they return home and they do self-isolation. As I said, when someone is in isolation, we hope that has either symptoms or no symptoms. And then if the test is negative, it doesn't mean that because he has been with the symptoms, he will stay there for 14 days. If the result is presumptive or positive, they are transferred to treatment center. For cases who are presumptive, we'll do the test within 72 hours. And if it's negative, he's moved from like those, because presumptive and positive, they are not in the same room, in the same hospital, even if all of them, they are like in the treatment center. We have testing facilities at all hospitals in Kigali and in the rural areas. They are doing tests because like epicenter of pandemic was in the Kigali city. We have created other areas, not only the hospitals. We have also created a stadium, have been used as screening center. And if there is like a region where there is a positive one, there is a creation of another sampling center due to contact tracing. All those samples all over the country, they are gathered and sent to national lab where there is a testing. And after testing, they send back the results. If someone is positive, immediately is sent to treatment center. If someone is negative, he's staying in isolation. If there was someone from home and the test is negative, he's staying at home with those hygienic precautions so that he will not or she will not contaminate others. Till if no symptoms within 7 days, he can keep at home. But people who are in isolation, they have to redo the test if there is new symptoms coming. In the hospitals, there is isolation rooms where we can receive a suspect who are sick, because if that one who is sick the test is positive, is sent to the treatment center to continue the medication. Not only the nasopharyngeal swabs is taken, also other laboratory exams, they are taken to exclude other conditions which can manifest as COVID-19. This is our screening area. We have a paper where every patient coming in our hospital is screened, either if he had contact with COVID-19 or if you have been traveling last 2 weeks. If he has fever, cough, sneezing, difficult breathing, they are sent immediately to waiting area. In that waiting area, they take, he's waiting to go to isolation for testing. This is if the patient who is coming and suspect is stable, there is a setup, because it was like a new condition where it came without too much preparation. We have prepared the tent where we can screen for stable patient. There is an entry before entering the screening station. They have to wash their hands, and then someone inside is prepared with the PPE to take the sample. After taking the sample, there is exit, and then they wash their hands. If no signs, immediately they went to home for self-isolation. If they have signs, they return to the waiting tent, wait for ambulance to evacuate them to isolation facilities. If the patient is not stable, there is a isolation room equipment where they can stay while waiting the results. If the result is negative, we are treating the condition, and as long as we have taken other lab tests, we are treating. If there is a fever, we treat fever. If there is a cough, we do chest X-ray. If it's a sign of pneumonia, we start antibiotics. And then if the tests come positive, immediately is sent to a treatment center. If the result is negative, is waiting to be stable within the isolation. And if stable enough, after 2 or 3 days, sent to normal isolation facility. Okay. Our isolation unit has all equipment so that if there is a critically ill patient, we may intubate and keep as long as we are his or she's still suspect. If that came negative, he stay there while waiting the next test within 72 hours to repeat the test, and all improvement on the condition. Next slide. This is like exit from our isolation unit. If a patient is like going to normal isolation, or if he's going to treatment center, the entry and exit, they are different. I think I'm done with like our preparedness and how we screen. Maybe Dr. Ernest can continue with how they treat patients who are discovered positive. Thank you.
Thank you very much, Dr. Appolinaire and Dr. Nahayo was talking. So my name is Dr. Ernest. I'm a physician in emergency, and I'm a representative of Rwanda Emergency Care Association. I'm going to talk about treatment of COVID-19 patients. Here in Rwanda, I'm in charge of the treatment center, both Kanyinya, we have 2 sites, Kanyinya and Nyamata. Next slide. For everyone who comes to our setting, he should have always like to take a history, but before the history, we do the conversation with them, giving them the instruction at the treatment. What are the measures of infection prevention control measures, like hand washing and the worst handling, how to wear a mask, what are the parts we need to protect, what we need to avoid to do, like touching everywhere, every place you go. For the social normal, are not allowed to have tobacco, alcohol, because of our patients we receive are really stable. They don't have really, most are asymptomatic. Some with fever, some with cough, but really no respiratory distress. So for the social also, we provide the food 3 times per day as breakfast, lunch, and the dinner, and also 2 liters, minimum of 2 liters per day. The medication we give for them, we treat the symptoms as usual, you know, there is no medication appropriate. For the fever, we give antibiotic, the dry cough, we give broncharen, the fatigue, we give the vitamin C, and for sore throat, we give like tea, ginger, and also lemon. For the painkiller, we start with the paracetamol and up to tramadol opioid. If you have the sign of pneumonia, we add augmentin. If it is like chest X-ray shows is signs of pneumonia, we can lower and we can add augmentin according to the status. If it is IV, intravenous, or can be through Peros. Next. We combine with different aspects. Daily we have the visit of counselor, where they interact with them, should have some, maybe fear the doctor to talk something, but with the counselor, you should ask him, go in deep, probably the social problem can come. So during the entertainment, because of, I told you, are asymptomatic, each room for the treatment has free internet, can chat with the family, can chat with the friends, and also access to the TV in the room with the old channels if we need to have some problem. And also the sport, if someone need to do the sport, can do in his own room. And the other specialties comes according to when you need them, like physiotherapist, like ophthalmologist, like pediatrician, if you need any advice, whatever it's up to us, me who are on the site, if I judge this should be have a consult, we call them and then we come and we discuss for the management. Every patient to us, we do the chest X-ray, for it is mandatory. Scanner, CT scan not, but if it is needed, we should transport the patient to the place. But we do the biochemistry and hematology. We do the ward round to evaluate the situation and to treat the new complaint. Most of the complaint they have, part of those who are really known, it has complaining some chest pain, but we need also to go, if chest pain comes, for the ECG to differentiate with the coronary disease. And also we do the tests when you go to discharge the patient or to take care of them before he came to us. We have done the swab and the confirm COVID-19 positive. We are going to repeat it after 14 days, according to the guideline we had here in Rwanda. And then from that swab, the test should come either negative, and they will repeat it after 24 hours. If become negative, we discharge her or him. So we need to have 2 consecutive negative, and then we declare COVID negative, then we can discharge. If the test then comes positive or presumed positive, where these genes, E envelope, gene and also RD, RN, the RN dependent, RN polymerase should not come or negative, we can have call those presumed positive. So positive or presumed, we repeat again after 72 hours. If we become negative, good luck, we repeat again the test, and if become negative, then we can discharge. If that test become now, after 72 hours, become positive, again we repeat after 72 hours, up to reach the first negative, and then go for the second one negative, then it take decision for discharge. In what we can tell, it's not the first time. With the experience I had, some like 1 quarter comes with the 1 quarter comes with the first negative. Others should come presumed, then positive, then presumed 2 negative. At discharge, we give some instruction to continue at home. We need to have isolated at home for 7 days. Avoid to be in contact with the public, any public person. Continue with the public prevention measures like hand washing, wear mask when you go to meet some people, and advocate to others, tell them how this disease is. Cannot fear of that. It's better to follow all instruction given by the health workers. How to follow them at home. After 7 days, we can follow them. We follow them on phone, asking them the symptoms. Are you okay? Yes. Any symptoms? Any fever? Any cough? No. Maybe any fatigue? Maybe. At that time, you can advise him what can he do. And also at 14 days, now we do oral swab and also take the blood to see if it has any, if before has any abnormal or any renal or liver have been corrected or not. And also to see the EGG for the immunology is there or not, have been created before, now it is going over for that. And also the Saturdays to do the same. And always when you call them, please follow the instruction given to the instruction to the health workers. Up to now, in Rwanda, we have received 314 total cases with the positive coronavirus. This was updated yesterday. With recovered 216, and still active case in our treatment center, 98 patients. So every day our machine can do the tests in the whole country around between the maximum is 1,400 in 24 hours. And up to now, there is no death, which really we need to encourage people if get the COVID can be recovered. So those are my presentation. Thank you very much for following us. If you have any concern, you are welcome to receive and to act.
Thank you so much for that presentation, Dr. Nahayo and Dr. Appolinaire. That was incredibly informative. It's always really helpful to see a snapshot of what's going on in all different countries. All right, well, because there are no additional questions and because we'll be sharing your presentation on our website, I think we can end our webinar now, but I just want to say thank you again to all of our attendees, to Steve for helping us with all of our technical issues and making sure that these events run smoothly, and then of course to our speakers, Professor Gitold, Dr. Ernest, and Dr. Appolinaire. We learned so much during this session and are really grateful for you guys taking the time. And then thank you all again for being so patient as we worked through our technical issues. I'm really happy that we were able to get both presentations in.